Amaxophobia, also known as car phobia, is an intense and persistent fear of riding in or driving a car. This fear can have a significant impact on an individual's daily life, as it limits their ability to travel and can even prevent them from going to work or school. The cause of amaxophobia is not always clear, but it can be triggered by a traumatic experience while driving or riding in a car, such as a car accident or a near miss. In some cases, the fear may also be related to a fear of losing control or having a panic attack while driving. Symptoms of amaxophobia can include rapid heartbeat, sweating, shaking, nausea, and difficulty breathing. These symptoms may be triggered by simply thinking about driving or riding in a car, or by being in close proximity to a car. In severe cases, an individual with amaxophobia may avoid driving or riding in a car altogether. There are several methods that can be used to treat amaxophobia. One of the most effective is cognitive behavioral therapy (CBT). This type of therapy helps individuals to identify and change negative thoughts and behaviors that contribute to their fear. This can include gradually exposing the individual to their fear in a controlled setting, such as sitting in a parked car, and gradually working up to driving on a quiet street. Another effective method is exposure therapy, which is a type of behavioral therapy that exposes the individual to their fear in a gradual, controlled manner. This can include visualization exercises, where the individual imagines themselves driving in a car and confronting their fear. It can also include virtual reality therapy, where the individual experience is a simulated car ride in a safe and controlled environment. Medications such as any anxiety medication, beta blockers, and antidepressants may also be prescribed to help alleviate symptoms of amaxophobia. But it is important to note that medication alone is not a long-term solution, and therapy must be used to treat the root of the problem. Another type of treatment is EMDR, eye movement desensitization and reprocessing. This therapy is used to process traumatic events that may have triggered the fear. It uses a combination of eye movements, sounds, or taps to access and process traumatic memories and emotions. In conclusion, amaxophobia is a serious and debilitating condition that can greatly impact an individual's daily life. This fear of driving or riding in a car can limit an individual's ability to travel and may even prevent them from going to work or school. The cause of amaxophobia is not always clear, but it may be triggered by a traumatic experience or a fear of losing control. Symptoms of amaxophobia can include rapid heartbeat, sweating, shaking, nausea, and difficulty breathing. These symptoms may be triggered by simply thinking about driving or riding in a car, or by being in close proximity to a car. In severe cases, an individual with amaxophobia may avoid driving or riding in a car altogether. There are several effective treatment options available for amaxophobia, such as cognitive behavioral therapy, exposure therapy, EMDR, and medication. These treatments work to help individuals identify and change negative thoughts and behaviors that contribute to their fear, and gradually expose them to their fear in a controlled setting. It is important to note that while medication can provide temporary relief from symptoms, it is not a long-term solution and should not be the sole method of treatment. Therapy is crucial in addressing the root cause of the fear and in teaching individuals coping mechanisms to manage their anxiety in real-life situations. It is also essential for individuals with amaxophobia to have a support system, whether it be family, friends, or a therapist. This can provide a safe space for individuals to process their thoughts and feelings, and to feel heard and understood. In summary, Amaxophobia is a challenging condition to live with, but with the right treatment and support, individuals can overcome their fear and regain their freedom to travel. It is important for those suffering from Amaxophobia to seek professional help and not to hesitate to reach out for support. With patience, perseverance, and a commitment to therapy, individuals with Amaxophobia can lead a full and happy life.